Hello, good evening, everybody. My name is Chris Magami, and I'm joined here with Alexis Page, working both in the VDH vaccination unit. I see a significant number of people still signing in, so we'll get started in just a couple of minutes. See, a couple more people have signed in, and we'll get started in just 1 minute. Okay, well, why don't we go ahead and get started? So just a round of introductions. First of all, welcome to the VDH webinar on an update for COVID vaccine boosters and third doses. We're happy that you joined us tonight. We want to give a very focused presentation tonight and give you an opportunity to ask questions either through the chat or I'm not sure that you can hear, or that we will be able to hear you in audio, but if you put your questions in the chat, we will try and answer those as we go. My name is Chris Magami. I'm a physician. I've been working with the Virginia Department of Health Vaccine Unit and working with medical practices and providers. And I'm joined here today with my partner, Alexis Page. So Alexis, if you wanted to introduce yourself.
Sure. Thanks, Chris. Thank you, everybody, for joining us tonight. We're excited to get to share some exciting information with you regarding boosters and new information coming out. Like Chris said, my name is Alexis. I'm the COVID-19 pharmacy coordinator for the Department of Health. My training is in pharmacy, so I'm a pharmacist, and I'm happy to field any questions related to pharmacy. And thank you all for being here.
Great. So the audience today will be a mixed audience of people in different medical practices, clinics, hospitals, and hopefully a really good representation by our pharmacy partners. Many of you know that over the last few months, we've been onboarding many locations and providers to give vaccinations. And currently, the largest proportion of vaccines are delivered by our pharmacists. And so we have a great debt of gratitude as that has shifted away from public health departments, mass sites into smaller, friendlier venues for the residents of Virginia. So we wanted to give you an update really on 3 topics here. One is updated information on third doses of the mRNA vaccines for immunocompromised individuals. Second is on the recommendations for booster shots, which we have started administering already and hopefully are aware of some of that. And then also we can comment a little bit about the age 5 to 11 approvals that we believe will be coming up in the next 3 to 4 weeks. So just if you bear with me for just a minute, I'm going to try and share my screen. Okay. All right, hopefully everybody can see that. All right. Well, we say this is all you need to know, but there is a constant flow of new information. So hopefully, if there are questions, you can put those in the chat as we go. So again, I'm going to cover third doses, booster shots, the summary of the evidence, and then just the current recommendations. So before I get into the slides on third doses, just want to make a few brief comments about 5 to 11. So I think it was in the news today that Pfizer has now submitted their information for approval for use in the age 5 to 11 age group. So there's a fairly predictable timeline that we're seeing now with the approval process. So that'll go to the FDA advisory committees. We believe the date of the meeting is going to be October 26th. That will go between the ACIP and the CDC in the following days. And what we've seen is a turnaround of just a few days. So if everything goes as planned, there could be an extension of authorization for the Pfizer vaccine for ages 5 to 11 right around November 1st. November 1st is a Monday. And so that's what we're planning around right now. In anticipation of that, we've been reaching out to pharmacy partners, to the family physicians and pediatricians, hospital systems, and our local health districts to understand the capacity that all of our sites have for younger children. We've also been working with our school districts at the health district level to understand which school districts would be going in the direction of in-school vaccination programs that traditionally we've done in years past with things like influenza. So that's really all the information that we have on 5 to 11 right now. But just keep your eyes open for new updates as we go. Let's talk about third doses just for a minute. There's been a little bit of confusion around the language that the CDC uses around what's a third dose and what's a booster. And basically, in the case of immunocompromised folks, they looked at the evidence in terms of benefit versus risk for the vaccines for patients who have received one of the mRNA vaccines. So basically, for people who had received 2 doses of either the Pfizer vaccine or the Moderna vaccine, the recommendation for immunocompromised folks was at least 28 days after a second dose to give a third dose of one of the mRNA vaccines. So this is a case where they're looking at the condition of the patient, meaning an immunocompromised state. Have you gotten 2 doses? And then preferably, if you have received 2 doses of Pfizer, you would get a third dose of Pfizer. If you had gotten 2 doses of Moderna, get a third dose of Moderna. They do allow that if the specific mRNA vaccine is not available, that you can give the other one. So for example, if you have a Pfizer patient and you don't have any Pfizer at your site, you can give Moderna. And the reason I emphasize this is because this is actually different than the booster guidance that we currently have. And as I said, things are changing pretty fast, but right now this is where we are. So we have been giving these third doses now for almost a month, and I'm sure you've had some experience with that if you are a currently active vaccination site. So a couple of things here. So immunocompromised. So there is a definition that is operational here, and it's fairly straightforward. So we're recommending that we're looking at moderately to severely immunocompromised people. And the definitions are pretty broad and pretty common sense oriented. So active cancer treatment patients, patients who have organ transplants or stem cell transplants, people with moderate or severe primary immunodeficiencies, or advanced or untreated HIV infection. Of course, if they're on immunocompromising or immunosuppressing drugs, that counts, and that includes high-dose corticosteroids. So those are the patients. But all of that being said, because we know that not every patient is going to be going to see their personal physician or other healthcare provider who would have access to their medical histories, we are relying on self-attestation from the individuals who are seeking vaccination. So if you're at a pharmacy and someone comes and they says, yes, I am immunosuppressed, our current VDH guidance on that is we're accepting self-attestation as long as we don't have some other conflicting information that's well documented. And we're going ahead and recommending go ahead and give those doses of vaccine. We've seen a little over 100,000 Virginians, maybe 150,000 Virginians at this point get third doses. So we're encouraged that the patients in these categories are engaged. And we expect to continue seeing that as time goes forward. So getting back to the language piece, these are considered third doses because the CDC's position on this is that we are now changing the standard for immunocompromised patients so that the primary vaccination series is a 3-dose series. So rather than just the number 1, number 2, now everybody who falls in this category going into the future would be recommended to have 3 doses. And that's why the time interval is what it is, with about a month difference between doses 2 and 3. So when we compare that or contrast that to boosters, boosters in the vaccine world are for people who have already had a primary series at some point in the past, and then they're getting a little extra boost of some immunization through a vaccine. And so just think about our flu shots. So it is recommended that most people would get an annual booster flu shot because we know that the immunity from the flu shots wanes over time. And so this is really the problem we're trying to fix here, or what are we trying to address with boosters? And this is a pretty sophisticated audience of medical practitioners, physicians, nurse practitioners, physician assistants, pharmacists. So I'm going to go through just a little bit of evidence just for a couple of minutes on why the recommendation from the CDC came out the way it did. So here's just one demonstration on the Pfizer vaccine. And on all of these slides, I'm really going to focus on Pfizer because that was the evidence that was used by the CDC. And we're going to talk about this VE. This is the abbreviation you'll see on all these slides for vaccine effectiveness. And so this illustrates that in patients who received 2 doses of the Pfizer vaccine and 2 weeks after their second dose, they had a very good response in terms of vaccine effectiveness. So you can see in all age groups here that you started out with somewhere in the mid-90s in terms of vaccine effectiveness. And in the green line, we talk about the pre-Delta period. We could see that there's some downward drift as time goes on. So by the time you're about 3 months out, most of the groups went from mid-90s to the low 80s in terms of effectiveness. The red line demonstrates the delta period. So you can see that that decline is pretty much the same, maybe a little sharper in the first 90 days. But now that we have more data and more time has elapsed, we can see that even though we start out in the mid 90s, by the time you get about 6 months out or so, you can see 200 days, we're down into the mid 60s in terms of vaccine effectiveness. And this is for protection against symptomatic infection. And so we're going to talk a little bit about protection against infection, hospitalization, and not so much around mortality, but there are some signals there as well. So this was a very broad group. I believe this was from New York State. Drilling down on this a little bit, another sample from New York State database just shows a very similar pattern in all age groups, where we see after about 3 months, the vaccination effectiveness against infection starts to decline. Now, these are real world data. They're outside of clinical trials. This is the real observational experience that we're seeing in these data sets. So what about hospitalization? So hospitalization, we can see that the vaccines are actually very protective for a long period of time. So you don't see the same kind of decline that you do for infection. And we've been talking about that all along, ever since the vaccines came out, that you still may get an infection, but it's not going to be as severe. It'll decrease your risk for hospitalization and death. The issue here was that as time went on and we start to look at the different age groups, and particularly looking at the people aged 65 and older, we do start to see a significant decline in protection against hospitalization at about 3 months or so in this particular data set. And you could say, well, 95 to start in terms of protection, going down to about 85 or so, that's not so bad. Well, the problem is that there are a lot of people who are age 65 and older who are vulnerable. And so this translates theoretically to tens of thousands of hospital admissions when you extrapolate this across the whole country. Now you can see this dotted line indicates the rise of the Delta variant. And so there's a little bit of overlap here. Some of this is time and some of this is Delta. If you were to ask the Department of Health right now, what percentage of the COVID cases in Virginia currently are the Delta variant, the number is somewhere around 98 to 99%. So we're pretty much in a Delta world right now. So when you say that you're looking at, does this apply to my patients? It absolutely applies to what your patients are experiencing today. All right, a couple other data sets. What about outside of New York? Looking at other cohorts across the country, observational data, real world study of 74,000 patients. We can see that we have a very similar pattern. And particularly, if you look at the last few months, the summer months, people who were newly vaccinated had about 93% vaccine effectiveness against hospitalization. But as time went on and Delta became more prevalent, that's dropped down below 80%. So the CDC was looking at all of this data when they're evaluating how to frame their booster recommendation. So we've talked a little bit about infection, hospitalization, but healthcare workers and people who have occupational exposures was also one of the major questions that was being asked. What if you're a healthy person, you're not over age 65, but your work puts you in the line of fire of getting coronavirus? So this study was looking at a cohort of 4,000 healthcare personnel, several cities across the country, and they did good surveillance of these folks, and they studied them for risk of infection, both symptomatic and asymptomatic in this case. And what they saw was, again, a very similar pattern where overall vaccine effectiveness actually wasn't quite as high in this real world population as in the initial studies and the others that I had shown you. But it went from 85 down after 5 months to about 73. But if you look at in the Delta era, down into the 66 range. So these are people who are nurses, doctors, respiratory therapists, pharmacists, who are in contact with people in their place of work. And even with use of good PPE, when you control for that, you're seeing some decline over time. So all of this really came together to illustrate that about 5 to 6 months after the initial series of an mRNA vaccine, in this case Pfizer, we're seeing some waning immunity in the older group, in frontline workers, and there actually was some mixed information about people with comorbid conditions. So this really just summarizes that in text, and I'll go straight to the current recommendations. So the CDC has made 4 recommendations around boosters, and the first 2 are what we call should recommendations, and the next 2 are may recommendations. And so where we really think that it is very, very important and there's a very good evidence base, they put should, and where there's room for some discussion and a little bit more detailed benefit and risk analysis, we talk about may. So the first one, pretty easy, pretty straightforward. People over age 65 or residents in long-term care facilities should receive a booster shot of the Pfizer vaccine at least 6 months after their primary series. So that's 6 months after the second dose. And again, this is only for Pfizer people. So unlike third doses, which was looking at here's immunosuppressed people, what vaccine did they get? This recommendation is saying you have people who receive Pfizer, can they get a third dose of Pfizer? So that's what the guidance is today, and we'll talk a little bit about what may be coming. So the second recommendation, that's also a should recommendation, was for people age 50 to 64 with underlying medical conditions to get that booster shot. And then looking at the younger population, the recommendation for 18 to 49-year-olds with underlying medical conditions gets a may recommendation. And then they throw in this language around basing this on their individual benefits and risks. So be prepared to have a conversation about what you think their risk benefit is of getting that extra dose. Last but not least, people who have increased risk for COVID-19 exposure and transmission because of occupational institutional risk may also receive a booster shot. I am a frontline healthcare provider, and I went and got my booster shot at a local pharmacy just 2 days ago. Very happy to do that. So those are really the CDC recommendations. And I will just add, we don't have a slide on this, that we are also expecting discussion and recommendations coming from FDA and CDC about Moderna and J&J. Apparently the first meetings on this will occur late next week. And what we might see from this is the Moderna vaccine is, they are asking for permission to give a third dose that is going to be actually a lower dose than the first 2. So if that gets approved, that's going to increase a little bit of the complexity there. And I think Alexis will be able to talk a little bit about that. And then we don't know what's going to happen with the J&J recommendation, but they have also submitted some pretty compelling data on the efficacy of a second J&J dose. So all things considered, we may, by the end of October, be looking at all 3 vaccines in the US being approved for boosters, and there could be some interchangeability between the Pfizer and the Moderna, but we don't know yet, and we'll just have to keep our ears and eyes open for that. So with that, I would like to turn it over to Alexis to hear her more pharmacy-specific insights.
Thanks, Chris. And thanks for going over all those new recommendations. We're definitely seeing and getting a lot of questions in the pharmacy regarding that. A couple shout outs regarding pharmacy. So if you are a provider enrolled in the state of Virginia, you are able to order smaller quantities of the Pfizer vaccine through a program called the Small Shipment Redistribution Program. And I'm sorry, that goes for all providers, not just pharmacies enrolled in the state of Virginia. So right now, the current ordering system through the state is 1170 doses of Pfizer or 450. And if you're a smaller practice or if you're a smaller pharmacy, maybe that's too much for you to use all within the time period before it expires. So you can order smaller quantities through SSRP. So if you're unfamiliar with that program, I'm happy to share some more information about that too. Another highlight that I want to touch upon, this is some new information. We at VDH, we've recently partnered with a QR platform where patients are able to have their own individual QR code, and that serves as like an electronic vaccination record. So that way it's more secure than having a paper COVID-19 vaccination card. So a patient can have a QR code on their phone and you can just scan it with your phone and just verify the immunization record without having to go into Viz. So that's pretty neat too. And then regarding, actually, Chris, I think that's all the updates I have so far, but happy to, field any questions too.
Great. Well, we're keeping our eye on the chat, so don't have any questions right now. I'm going to go ahead and show you a little bit more information here because we got a couple of other things that we're offering. So one is for all of our medical providers out there, we do have a program called the VDH COVID-19 Teletown Hall or webinars. And this is really a nice option for you if you're looking for a way to communicate with your patients. What this allows you to do is get in contact with us, and we can set you up with a web platform like the one we're on now. You don't have to do any of the technical issues. You can invite your patients or others that you'd like to speak with directly. We'll provide you with presentation materials, and even if you would like to have a guest or an expert, we can arrange that for you. We've done quite a few of these around the state now, and they're pretty popular with the patients. We're hoping that this is a good way to combat some of the vaccine hesitancy and some of the questions that people frequently have. And you can do this with a significant number of people all together. All right, so we are actually getting some questions, and I think Alexis has answered those in the chat. For folks on the phone, there was a question that said, I've been asked by my patients how to get a QR code. And you can refer patients to vaccinate.virginia.gov. And it's actually fairly easy. You can just click on a couple of links and they'll be able to download their QR code. And I went to a film festival the other day, and I used my QR code to show the folks at the door, and it worked great. So let's see, we have a comment here. It says, QR code is not for anyone who received a CDC vaccination card. So we receive a QR code for the third dose from a vaccine provider. So the way the QR code works, and Alexis, you can jump in anytime, is that it's linked directly to the vaccination or the Virginia Immunization Information System, or VIS. So that's the database that the state keeps. And when you get the QR code, it actually lists the doses that you've gotten. So obviously we can keep using the handwritten cards, but this happens once those doses get registered from you guys as registered providers. I think I got that right.
Mm-hmm. Yep. So it's connected with Viz. So it shouldn't matter, what type of facility you received it from, as long as it's reported to the Virginia registry, patients should be able to have a QR code.
All right. We got another question from Dennis Sager in the Q&A. It says, will you provide Moderna under SSRP? that one's for Alexis for sure.
That's a really great question. So our small shipment redistribution program is surprisingly, but not surprisingly, very labor intensive. Taking those large quantities and breaking it down and shipping as little as one vial to a provider's office of Pfizer is very labor intensive. We don't right now have the resources to broaden that to Moderna, but that is something that we are looking at and have been trying to figure out logistic wise how to implement something like that.
Yeah, so the other option on that for many sites is to work with your local health district, because the local health districts are doing some basically repackaging of smaller amounts. And so depending on which health district you're in, that may be an option as well. So Alexis, have you heard anything about, more or fewer side effects after the booster shots in people who have been getting them?
So what we've been hearing is the side effects are pretty similar to what the side effects patients can experience with a first or second dose. So that would be just, a low-grade fever, general fatigue, headache. And so the side effects tend to not be any more severe than what patients have already experienced. And so just having, resting and hydrating and tend to be the best solution.
Okay, thanks. All right. So this is a good question. Is there data to support a booster actually improves vaccine efficacy? So there is data that shows that you do have a response to a third dose, which basically means when you measure the neutralizing antibodies, you do get a uptick in those. In terms of outcome studies that are looking at the prevention right now of infection, there's actually not a lot of data on that yet. It would only be a month or maybe even 6 weeks old at this point. So great question. But we have every reason to believe that it does correlate, that the protection does correlate with the increased antibody levels. All right. So here's a follow-up question about the QR codes. It says, do you realize that QR code only works if your cell phone is listed as your home phone in the Viz record? So Alexis, looks like you wanted to.
So we have run into the problem where patients did not report their a good phone number for either on the consent form or when they were signing up to online to make an appointment to get the vaccine. So what a good solution is to have that patient call the Viz help desk. Viz can input that patient's phone number into their profile in Viz, and then the patient will be able to download the QR code.
Yeah, there is a toll-free number that's listed right on the page. And again, my personal experience, I actually had to call that number. It took a couple minutes and it worked right away. I've put another slide up here. There are 2 more upcoming webinars that we have scheduled so far with VDH. The October 20th one is focused on pediatric vaccination. And then we'll have another one on November 3rd that's talking about the evidence. And I think just, to reflect on the questions, the evidence keeps changing. And so I would hope that we'll have better data on the vaccine efficacy for the boosters by that time. And we've got some really good speakers who are lined up for these webinars. All right. There's some more questions. Go ahead.
Yeah, so Chris, I'm going to pitch this one to you. So it says, is there data to support a booster actually improves vaccine efficacy?
Yeah, we kind of talked about that one before. And then I see that Jennifer also asked a follow-up question about the safety data. And I have actually seen the safety profiles related to the third dose administration. I unfortunately did not include that slide. But basically, if you were to look at the adverse effects that the patients experience after second doses and third doses and did sort of a bar chart comparing the percentages, they're almost identical. So it's got, the way I would interpret that is it has the same safety profile as a second dose. And then there is another question here that says, has guidance been updated so influenza can now be administered concurrently with COVID-19 vaccines? So Alexis.
So, the CDC has, made the recommendation or has updated the recommendation that COVID-19 vaccines can be co-administered with other non-live vaccines. So the CDC encourages that patients receive a COVID booster and the flu shot at the same time if they're indicated for a booster or a third dose. Obviously, we want to make sure that the injection sites are at least spaced out by 1 inch or in separate arms, preferably. But we are recommending and making sure that we are communicating that and encouraging influenza vaccines to be administered at the same time as COVID vaccines.
So here's a tricky question. So if you get a booster and you don't get your flu shot on that same day, do you have to wait any period of time, or could you go and get your flu shot whenever?
Are you asking me?
I'm asking you.
Well, I believe with other non-live vaccines, the consent forms always ask if you've had a vaccine within 28 days of each other. But right. You tell me if that matters, if it's non-live, if it's a not live vaccine or a live vaccine.
Yeah, the reason I asked you that question is because it's still on the consent forms. And so yeah. I think what that tells me is we should really encourage people to just get them on the same day.
Yeah, I agree.
Because otherwise it gets a little confusing. And I don't believe there's any harm to giving it in a shorter window, but it's always the opportunity, when you have the opportunity to give the vaccines, they're not necessarily going to come right back. So try and get them while they're there.
Agreed. You set me up, Chris. But I agree with you.
Well, it's all new and it's all dynamic. Okay. All right. We'll give you a last call here. I know that we are standing between a lot of people and their dinner. And so if there are any other questions, we'll hang out here for just a couple minutes and see if anybody wants to put anything in the Q&A or the chat. Okay. So this one says, should we reschedule if patient received flu 10 days ago? So again, the consent form, to my understanding, currently says 28 days. This could change, but I think that the safest answer is yes. And that's a great opportunity for me to talk about something else that I didn't talk about earlier, which is we're talking about boosters. So all these people have some level of immunity now. So unlike back in December and January when the vaccines were rolling out, and you could make the argument that there was a real emergency to get people their vaccines, boosters are a little bit more on a window of opportunity to get vaccinated. So if they have to wait a few days or even a couple of weeks, that's okay. Let's see, do we have more info about getting the pediatric doses for 5 to 11 once approved to ship to our office?
So, do you want me to answer?
Yeah, if you could get that one.
Okay. So we're practically in communication with the CDC almost daily. And the communication that we're receiving from the CDC is that we're planning for distribution of the pediatric Pfizer vaccine by the end of October. The dose will be different. The vial will be different. It will be a completely different NDC. So right now for Pfizer for adults, the dose is 0.3 mLs. For this pediatric Pfizer vaccine for ages 5 to 11 will be 0.2 mLs. It will still require dilution with normal saline, but that dilution amount will be different. The vial size for this new Pfizer product will be, it will have 10 doses per vial. So a lot is changing with this new vaccine. And so that's why it's really important to, stay current with the information as it comes out. Regarding distribution, like I said, by the end of October, information about the distribution is consistently changing daily, it seems. There may be some allocation. So we may have to allocate to areas with highest need first. But again, that information is tentative. It's not final. So just wait for more confirmation before doing anything.
Okay. All right. This one, I don't have any new information, but maybe Alexis does. Says, will the 15-minute waiting period after you administer the vaccine ever be reduced?
I don't think so.
Well,
Probably
we can always hope. We can always hope.
Yeah, probably from a liability standpoint, probably not.
All right. Let's see. All right. Well, really appreciate your attention and the interactive nature here. Great questions. We are going to put a recording of one of these on our website. And so if you have colleagues who need more information, just send them to the VDH website, and we should have a link to this and a lot of other information. So appreciate everybody's time tonight, and hope you have a great evening.
Thank you so much, everyone.